All right, welcome Louise, welcome Anne. We have a lot of people signed up, but most of them aren't here yet, so maybe they're going to come later. But welcome to you both. I'm Dr. Andrew David Shiller. Welcome, Denise. And let's get started. I have a lot of information to share. And I love doing these kinds of webinars. And okay, I'm sorry it was difficult to find the link, Anne. Yeah, I can look into that for the next time. I'm not exactly sure why that happened. In any event, let's get into it, right? Because fatigue is such a pervasive problem and a lot of people are suffering with fatigue. So I want to shed some light on that to help you understand, well, why does fatigue happen? What can you do about it? And let's just jump into it. So what I'm going to do is give this presentation. It's going to be a lot of information. You don't have to get every fact. There will be a recording that you can get if you want to. You can contact the practice. I think they'll be sending it out. I'm not exactly sure how that happens, but Rose Wellness, I think, is going to send it to you if you registered for the Zoom here. And if you're watching this on the Facebook feed, give me a shout and I'll let you know when it gets posted someplace and we'll figure that out. My purpose here is to help inspire and educate you all, because I know that a lot of people with fatigue and related symptoms don't get what they need from the regular doctor. So let's jump on in. Welcome, Bob, also, and Denise. So why are some doctors so bad at this? I'm going to read this cartoon. We've got the doctor saying, good news, all of your tests were negative. And we've got the person who's the patient here saying, how can that be? I'm always tired, fatigued, with no energy, headaches, can't lose any weight. Anybody here relate to that idea? I have to say, I've, as a functional medicine doctor, hear that from my patients all the time, that they've seen so many people. And then they come to me and I'm just sharing a different perspective and a different way of doing it. And they say, wow, nobody ever asked me those questions before. So let's unpack what that is and why. So first of all, there's a couple of issues in medicine that are what I would call our biases. This is the way I was trained. I was trained in conventional medicine, internal medicine, and rehabilitation medicine, pain management. And we get to train to look for one disease, one cause, one treatment, which is fine if you're treating pneumonia or if you're treating another kind of infection. But a simple solution to a complex problem often doesn't work. And fatigue is a complex problem. The other thing, there's actually three forms of bias. The other thing is that we get trained to think about populations, you know, the data from randomized controlled trials. Well, it doesn't always applicable to an individual sitting in the office and looking at the individual and understanding their story and who they are and what are their symptoms, where are they coming from, what are their struggles. Because in my experience, that deeper history where I really listen and I explore what's going on from the time this person was born gives clues about the underlying factors, about the triggers, and about the state of the person's biology. So I tend to think about the biology and the underlying things that could be contributing to the problem. Welcome later arrivals, Sheila, C. Hogers, and Jose. And we'll keep going. The last thing is fixing versus healing. Medicine is all about what's broken. And it's important to be able to diagnose stuff that's broken. But there's another issue, which is healing. And my personal belief after 25 years of practice and 40,000 patients and huge amounts of study all over the place, all over the world really, is that you have an intrinsic healing intelligence inside of you. And part of recovering from fatigue and chronic illness is learning how to stimulate that intrinsic healing. It's an interpersonal thing that requires education and persistence and determination, but you can do it. So let's keep going. So when a doctor thinks about fatigue, they think, here are the different causes of fatigue. And it's a whole bunch of medical diagnosis, endocrine things and blood things, infectious things, neurologic problems, psychiatric diseases, rheumatologic inflammatory diseases. I'm sure you've heard some of these names. I'm not going to read them all. The point is that these are diseases. These aren't underlying causes. The disease itself is an effect. And the conventional medicine approach to fatigue is, well, let's think of all these things that are effects of other causes. And if we know the effect, well, then we can give a drug for that effect and stop those symptoms. And then maybe the fatigue will go away, but it often doesn't. Because I see the people with Crohn's disease and ulcerative colitis, rheumatoid arthritis, or other inflammatory diseases, with people with depression, people with schizophrenia, people with endocrine problems, where they get the right drugs and their symptoms of that disease, classically defined, are controlled, but they still might feel crummy, heavy, tired, fatigued, low energy, various things going on that nobody really knows what to do with. And the issue is that the drugs are treating the effects and not the cause. And so I'm going to talk about how we go upstream and understand more fundamental cause of fatigue. And again, another more differential diagnosis of fatigue. Here are the causes of fatigue, and it's really just other diseases that are associated with fatigue. And it doesn't tell you anything about how to address the fatigue itself. So here are some underlying contributors. We're talking about treatable issues with a person's life, things that we can work on that I didn't get trained to think about in medical school. And it wasn't, until all these years of practice and advanced training in functional medicine that I started to think about stuff like sleep problems, sleep apnea, restless legs, emotional distress. I'm just going to go through this. Hormonal imbalances like adrenal, thyroid, sex hormones. These are treatable things that can actually be addressed and get at the underlying roots. Toxic exposure like heavy metals, air pollution, impaired detox pathways. These create a burden on the body systems. They create a sense of danger in the body systems. And that's what eventually results in fatigue in many cases. They wear down energy production. Immune imbalances, whether they're like occult infections, dysbiosis, leaky gut. Maybe you've heard of some of these diagnoses. Food intolerances, which in conventional medicine, we don't really think about very much. Nutrient deficiencies. The person who comes in with a vitamin B12 of 220, and that's normal according to the textbook, but for that person, it might not be normal. And unless the doctor thinks to look at it, look for it, and look at the functional correlate of that B12, then that's just going to get overlooked. And I've seen that dozens of times. Like your B12 is 220, you've got chronic pain and fatigue. We increase the B12 and the person feels better. But wait, it's normal. What's going on? Well, look, my feet are size 12. Normal shoe size are 8 until 14. But if I put on a size 10 shoe, I'm going to be pretty uncomfortable. Mitochondria, those are the organs in your cells that produce energy. And when they get sick, your body doesn't have energy. Your cells don't have energy. Mitochondria, from a functional point of view, are probably the common pathway of what creates fatigue. And we're going to talk about how all of these things can be connected and related to each other. Oxygenation, that can be a complex thing, right? Because you could be anemic with a low blood count. So it's like your blood cells are sort of like the trucks that carry the oxygen. If you have anemia, it means you don't have enough trucks. So however hard your heart beats and they're going fast down the road, but there's not enough of them. So your tissue's not getting enough oxygen. On the other hand, you could have other issues that prevent the oxygen from getting into your tissues. And that's a complex process. There's a lot of reasons for that. If a person has sleep apnea and at night they're not breathing, their oxygenation is going down. If they have issues with iron deficiency without anemia, it can create things like mitochondrial dysfunction and impaired oxygenation. And then dehydration. It's another way not to get enough blood flowing in your body. It's another way to feel tired and exhausted. And not all docs are thinking about this stuff. I just want to re-emphasize, I'm going to share a ton of information. If it's overwhelming, don't worry. There's going to be a replay. There's going to be a recording that you can get from Rose Wellness. And if you're checking into this on Facebook, let me know there and I'll track it down for you. So this is the same list. I'm going to use hormonal imbalance, especially the adrenal system, as kind of a focal point. Because like I said, a lot of these different things are all connected with each other and they interact and create the problem of fatigue. And one of the common pathways is imbalances in this system of the adrenal glands and the systems that regulate the adrenal glands. So we're going to focus on that and let everything kind of orbit around that. And hopefully it'll make more sense of it, so it won't be just like an overwhelming list of issues, okay? Again, if you have questions or comments, you can put them in the chat, whether you're in the Zoom or on Facebook. I'm watching and I'll try to check those out and respond. Okay, so what overstimulates the HPA axis? What is the HPA axis? I'll give you more detail in a second, but the A part means the adrenal glands, and HP is your pituitary and hypothalamus. It's part of your brain that regulates your adrenal glands. And a lot of different things can make your adrenal glands get overactive and say, wow, we've got a problem here. We have a perceived danger in the body. We have to deal with it. We have to get up and go. It's the stress response. You have a stress response, a relaxation response. Stress response is fight, flight, freeze. Relaxation response is rest and digest. Stress response is get up and go. Get up and go for a lot of different reasons. It could be that you're working on, well, let's unpack this. So this is from one of my colleagues, Dr. Williams. He's a beautiful, amazing, intelligent PhD professor who really unpacks a lot of this integrative biology and physiology. And he suggests 4 different ways to think about it, 4 different quadrants here. One is this perceived stress thing. And that's kind of like where our head is at. And most of us think as stress as our mental emotional stress. I want you to open up your mind and realize that stress is a far broader context. It's the way your overall organism experiences a sense of needing to get up and go, a sense of feeling threatened or in danger. So for sure, there's a perceptual thing that has to do with feeling out of control, relationships that are difficult or traumatic, old trauma, burnout, working too hard, feeling like things are all new and out of control, lots of change. Like, what did the pandemic bring? So much change. People weren't knowing how to deal with that. Just want to welcome also MS and Romilia and Letizia. All right, let's keep going. So one aspect is the way we perceive reality. And part of that has to do with where your head's at. What's your mindset? Do you have good social connection? Do you believe in yourself? Do you have negative beliefs about yourself? Are you walking around with confidence or with self-blame and self-doubt and self-shame? That can create a lot of stress. And then there's the biochemical aspect of it. And, you know, he's listing some of the biochemical neurotransmitters and things your brain uses to communicate and create a state of calm on one hand, or a state of anxiety, overwhelm, sadness, grief, loss on the other. And a lot of that is biologically determined by biochemistry that's in your brain. So it's the thoughts, beliefs, emotions, and the biochemistry together. That's this blue quadrant here. The second part is this greenish one, circadian disruption. What does that mean? The circadian rhythm is the way your body is entrained with daylight. We're meant to, the world wakes up in the morning when it gets light, and it goes to sleep at night when it gets dark. That's the way we're meant to be living. Unfortunately, we live in a different kind of world where we frequently have light 24/7. We frequently use lots of caffeine to stimulate ourselves and keep ourselves awake. We might have pain keeping us awake. We might have sleep apnea like we talked about. These are things that mess up the healthy sleep cycle. And by messing up the healthy sleep cycle, we don't get that healthy circadian rhythm. Letizia is saying, I've been diagnosed with thyroid problems. How could this affect my energy levels? I'm very tired recently. Yeah, I'm going to aim to talk about that because the adrenal system affects the thyroid system. And I'll share a bit with that in a few minutes. Let's keep going on this model though, okay? Circadian disruption, that normal day-to-day cycle of awake, asleep, that's meant to be entrained with light and dark, but isn't, because we got lights all the time. We got people working shift work at night and they don't go to sleep. People who have jet lag because they fly across multiple time zones. Daylight savings change things. You know, when we don't have a circadian rhythm, things get out of balance. And it's the main driver of our HPA axis, is that circadian rhythm. So next thing is inflammatory signaling. Do you see how this is a much broader concept of what is stress? Because it's not just, hey, I'm stressed out because my boss and my wife and my husband and my kids and all my responsibilities and I'm scared and anxious. Stress is biology too. And when you have inflammation in your body, it creates a stressor and your cells perceive it as danger, danger, we got to do something. We got something attacking us. We'll talk more about this. But so the point is that a lot of different inflammatory signals, whether it's inflammation in your gut from dysbiosis and leaky gut, whether you got a diagnosed inflammatory problem like arthritis, cardiovascular disease is an inflammatory problem. You know, the thing that gives people heart attacks and strokes, it's inflammatory. Allergic illnesses and infectious diseases anywhere in the body create inflammatory signals. We call these things cytokines. And if you think about it in a certain way, if you're sick, your body needs to ramp up and fight against the illness. And your stress response is part of what does that. The last part, the fourth quadrant, glycemic dysregulation. That means blood sugar. Because when your blood sugar is out of your whack, your stress system is out of whack. It's a vicious cycle. And so there's a few things that can do that. Like the way we eat. If you're eating a low fiber, high carbohydrate, low quality diet, if you're eating meals at strange times, if you're doing stress eating because you have a lot of stress and you're eating comfort foods, which feel so good going down, but then like they wreak havoc on your body and raise your blood sugar. If you've gained a lot of weight, low physical activity, those are all stressors. They activate your stress system. They create a bodily sense of activation. And that is the main driver of fatigue. And I want to show you why. So stay with me. If you have questions, put them in the chat. We're going to talk about all of it. So this stress response is a crucial function. Fight, fight, please, get up and go. It's there to take care of you. It's there to help you deal with life, to maintain your blood supply and nutrition to all your organs, to help you produce energy by metabolizing, nutrients, to optimize your cellular energy production. Your mitochondria are like produce little gas tanks, and the gas tanks is what your cells use. When your mitochondria aren't producing gas tanks, when they're sick, your cells are tired and you feel exhausted. Thyroid is one of the things, Ptsd, that helps activate the energy system along with cortisol, which is the main hormone for the adrenals. We'll talk about that. So the problem is that when that stress response is too strong, too much, too heavy, too all the time, and basically it's like the emergency vehicle, like if there's some huge fire and the police close off the roads and it's fire trucks going and no one else can drive on the roads. So we need to do that because they got to put out the fire. There's an emergency. But after a while, the traffic is backing up and the normal things that are supposed to happen aren't happening. And that's part of why we get sick from this chronic active stress response. And that's part of why we develop fatigue from it. So cortisol and DHEA, two big adrenal hormones, they're doing all kinds of important stuff. We already sort of talked about it. It's energy metabolism. It helps us detoxify stuff. It helps our brain be healthy. It helps your endocrine function, your metabolism. It helps your muscles and bones be strong. It helps modulate inflammation. It's not a bad thing, cortisol. It's a good thing. But the problem is when it gets off the rails and all this stuff gets backed up because it's an emergency mode and the normal stuff isn't happening. PTSD, someone, Sheila, just asked about. PTSD is a state, we'll talk more about it in a bit, where the adrenals are all out of whack. And that's why people with PTSD can be exhausted all the time. I'll explain more about that shortly. So still unpacking this whole thing, right? Because we talked about this HPA axis, hypothalamic pituitary adrenal axis, and the stress response, the get up and go, fight, flight, freeze, right? But that is living and working very closely with your immune system and all the stuff in your gut. And if you think about it, these are three ways that your body is surveying reality, right? In order for us to be safe and function, your brain and body together, your mind-body system is constantly assessing, how am I doing? And what's going on in the world around me? Am I safe or not? And if you think about it, your whole digestive tract is the outside. When I eat something, a little cup of tea, it's coming from the outside, it's going through me. It's the outside going inside. And so your gastrointestinal tract has got a massive surveillance system with immune cells and all kinds of signals that are communicating back and forth with the brain, with the immune system, with the stress response. It's a coordinated three-part thing: the stress response, the brain, the immune system, and what's going on in the gastrointestinal tract. And I'm going to just share this in a little diagram. This is going to get a little complicated, but this is part of how we understand the stress response, right? Because genetics and early stuff that happens in life, this is where PTSD can come in, because when a person has trauma early in life, early adverse childhood events, it can really prime and shift that stress response to be overactive for decades, unless the person heals and does stuff about it. And so we got this whole thing in our brain. This is our HPA axis. This is sleep. This is mental, emotional stress. And those all interact with each other, because if I'm all hyped up from stress, I tend to have more emotional anxiety. If I got a lot of anxiety, my stress response is hyped up. And both of those keep me from sleeping. But if I'm not sleeping, that hypes up my stress response. So it's a vicious cycle. And then we got these mitochondria, like I talked about, where when the stress response and the sleep disturbance and emotional distress is on overdrive, they stop functioning. And what's the result of both of these things? Fatigue. And these are big drivers. You know, this whole activation of stress response and the biochemistry of stress is one aspect of fatigue and energy. There's another way that you can think about it that's a little bit more of a metaphor, but it holds up, I think, in life, in my experience and talking to tons of people, which is that, like, imagine at a given moment, you got a given amount of energy coming in, like you got an energy bank account, you got a pipeline coming from wherever your body makes energy, and it's coming into your head or into your body. But you're busy, you're thinking and you're worried about this thing and that thing. Your attention is getting drawn to things you're concerned about. You're worried about the boss, you're worried about the money, you're worried about the kids, you're worried about what's going to happen with the corona pandemic. Oh my gosh, all these things are changing. Your mind is getting sucked in so many different directions that you're not here and now in the moment. You're in your device, on your phone, checking and looking and reading bad news stories. So the whole point is, like, you can be devoting your energy towards being scattered, and that's taking your energy away from living. And that's another source of fatigue for a lot of people. So let's keep moving. If you have questions, put them in the chat, please. So this is just another way of looking at what we talked about up here a second ago, right? This three-part system. Here they are, right? The brain, the gut, and the immune system. Interconnecting. It's really one system. And this is a driver of so many different chronic disease states, whether it's in PTSD or hypothyroidism or autoimmune disease or brain disease like dementia, cardiac disease, fatigue. All of it, we're learning, has brain, gut, immune system interactions to it. And the good thing is, this is getting at the mechanism. This isn't just defining the problem and saying, here's how you're sick. This is actually saying, here's how you can get well. That's what we try to do in functional medicine. So let's keep unpacking. I'm just going to share a little bit more, just another diagram. This is from the Neurobiology of Stress. It's a medical journal. And here's a picture of the gut. And here are all those cells that live in your intestine, right? And here's the inside where you swallow food. It's cruising down there. All around your intestine, you got all this immune function, right? The things that are inside your intestine, the bacteria, the healthy bacteria that live in there are part of what balances the immune system around your gut. The neurologic signaling from your brain, whether it's stress or relaxation, is affecting the health of your gut, the health of the lining of your gut, the immune cells. This is real biology. It's treatable, it's healable, and it's something that right now, it's in the medical literature, but the average doctor is not thinking about it, because the most up-to-date science takes decades to get into common medical practice, unfortunately. That's just where we're at. That's what's going on. Okay, so let's not get too bogged up in the details. The whole point, the gut, brain, immune systems are part of driving fatigue. And so let's unpack this a bit, because we already talked about this whole thing. Genetics, early life trauma, adverse childhood events are kind of like setting the stage, and setting the stage for an overactive stress, sleep, and mental emotional anxiety state. And then we bring in that whole gut thing, the gut-brain axis. And we can have issues with the biome, the bacteria living in our gut, the permeability. Maybe you've heard of leaky gut. When I was just finishing residency and I started thinking about holistic medicine, this whole leaky gut thing sounded like so much nonsense to me, and we used to laugh about it. But now every medical specialty is talking about changes in the biome, barrier permeability, and gut-brain axis relationships, because they affect the brain, because they affect immune balance. When the immune system is out of balance, there's too much inflammation, you get something that's oxidative stress. That's cellular stress. That's not just, hey, I'm stressed out in my mind and my head. That's my body is stressed out biochemically. When the gut gets sick, we don't absorb nutrients we need to absorb. Our mitochondria get dysfunctional, and yes, driving fatigue. So this complex system driving fatigue, and then the things that are associated with fatigue, like pain. Anyone out there got pain? Brain fog, where you just can't think straight, or you get confused by stuff you used to be able to figure out. When your mood is low and sad, I guess I wrote mood twice because it's so common. And then gastrointestinal problems like constipation, diarrhea, cramps, abdominal pain, sleep problems, and so on. Is that familiar to anybody out there? Okay, let's keep going. So, getting back to this conventional view of what causes fatigue, where these are just diagnoses, and diagnoses are effects. Underlying the diagnosis is all these different underlying problems, like the stress axis and the gut-brain axis and the immune system, like I just talked about. Those are the underlying causes flowing downstream, and then you get a diagnosis of whatever it is, hepatitis or arthritis or lupus or heart failure or PTSD. Meanwhile, that process has been going on. So we want to go upstream. We want to go towards the cause. What's the underlying process? And then we get a different view of it, and we get a different way to think about it. Now, I just shared a ton of information about all these different things, and I suspect it could be overwhelming to think about that. And you don't have to think about all of it, but I want to share how I think about it as a functional doctor, because we have a little thing that we call a functional matrix, right? And it kind of breaks it down, right? We got our whole digestive system. We've got our system, our immune system, which is like defense and repair. We've got energy production, mitochondria, hormones. We got a detoxification system that cleans the blood, cleans the body. It's working all the time to help you be healthy. We got transport, like your cardiac system pumping blood and your lymphing system pulling out toxins, and then all the communication systems in your body structure. When these things are in balance, you're healthy. And when they get out of balance, that's when health starts to fail. And what we do from the functional point of view is start to look at these things, and you sit down and I listen to my patient and I ask them, well, what's bugging you? And we hear all the symptoms in the different body systems. And it gives us an idea of which of these systems are out of balance. And that's part of what helps us think about what are we going to do about it. So that's where the pedal hits the metal and the rubber hits the road, you know, like, what are we going to do about it? I just want to point out that all of these things are connected. They're like a cycle, right? For better or for worse. And that in the core of it is your mental, emotional, spiritual state. Like, what kind of thoughts and emotions and sense of connection? Are you living with a sense of like, you know what, I'm good. I know what I'm doing. Things might be hard, but I'm connected, I'm focused. I got things I care about. I got people I care about. I'm doing things I care about. I know things are hard, but they're going to work out. And that's a positive state. Or are you in a state of like, really scared, man, I don't know, you know, like things are really hard and it's out of control, and you know, self-doubt, self-hatred, all these difficult things. It's a spiritual issue. It's a core thing. And that's where real deep healing can be so valuable to influence all of these systems. So let's keep going. Share your questions if you got them. I'm going to keep going in the meantime. I hope this is good for y'all. Little sip of tea. I like green tea because it very gently gives me energy. Green tea stimulates with caffeine, but it's got other stuff in it that are antioxidants, that are calming molecules, that actually stimulate the brain and the body, but they create a calm stimulus, which is why I tend to drink green tea. Sheila's sharing, yes, I think she's saying she's got pain a lot, and also I'm always looking for something to go wrong. And I bet if we were sitting in a circle and I asked people to put their hands up, the ones who were courageous, probably half of you would put your hands up, and then another probably 50% would be thinking, yeah, but not putting their hands up, because that's the way it often goes. I don't know if that's true for you or not, but like a lot of us are like that these days. We live in hard times. A lot of us are always looking for something to go wrong. And if you've had a stressor, if you've had an illness, you know, that if you're not feeling well in your body, there's biochemical, physical reasons to get that sense of, I'm just nervous, things are going to go wrong. Romelia is asking, can you also address food allergies and how the gut can be healed to accept tree nuts, peanuts, and sesame? What a great question. Yeah, wow, it's big. I'm going to speak about that briefly right now. I can't really go, that's a whole talk, Romelia. Romelia, tell me if I'm not pronouncing your first name correctly. I think Singh is your last name and Romelia is your first name, if I understand correctly. Tell me if I'm wrong. I apologize in advance. But so a lot of people have food sensitivities, and many people are sensitive. There's two things. There's allergies, where a person can eat something that actually creates an allergic reaction that makes them sick, deathly ill. Like you got to go to the emergency room, where the whole immune system, like forest fire, right? And then there's sensitivities, which aren't as intense as allergies, but they can create a low-grade inflammatory response. And so it could be one or both of those things. And I think that's what Romelia is thinking about, either real big time allergies or food sensitivities that create immune dysregulation, that drive this defense and repair system to be busy with defense, thinking it has to fight a battle. Meanwhile, the immune system is supposed to also repair stuff. And it's like we said, where, you know, the emergency vehicles are going all the time, so the normal traffic can't flow. And that's what can happen when you've got food sensitivity that activates that gut axis. And yes, there are things that can be done to heal it. It's like a 5-step process. It's a whole other conversation. So I think that's where I'm going to leave it for right now, but it's a great question, Romelia, and maybe I'll have an opportunity. Right. Yeah. Okay. So Romelia is saying, yeah, proper food allergies require an ER visit. Okay. So I understand it's a bigger question you're asking, because we're not just talking about food sensitivities. We're talking about full-fledged, what we call anaphylaxis, where a person gets really sick. And can that be healed? My response is that I know a lot of people who've healed that. And it's not simple. It's really about looking at the whole picture, especially how the stress response and the immune system are interacting with each other. Sometimes it's usually a combined approach. A big part of it can be tuning up and healing the gut and reducing the overall immune reactivity. But sometimes anaphylaxis and big stressors are coming because some kind of traumatic experience. And so frequently a person who really goes into a deeper trauma healing oriented approach can have a significant impact on that. And I definitely know some cases where people really were able to change that. It's not that they went out there and they started eating everything again, you know, because you probably have been told, if you had anaphylaxis, never eat that stuff, because that's the way we tend to think about it in conventional medicine. Like if something's dangerous, it's dangerous. But the whole idea is heal as best you can. So if God forbid you get exposed to one of those things that once called anaphylaxis, maybe you won't even know about it. That's the best I can say about it right now. It's a real issue. I'm glad you brought it up. Okay, so we're going to focus on that whole adrenal system, right? What are your adrenals? This is a picture of somebody's belly that sort of cut down the front, like a saw blade come across this way. And you'll see the kidneys there. All of their intestines are taken away. Here's their chest. Here's their legs. These are the big vessels. The kidneys are right here. And the adrenal kidneys are called renal, and adrenal sits on top of your kidneys. And your adrenal is what produces cortisol, and this other hormone called DHA is related. There's other hormones in there, aldosterone and sex hormones, that are produced by your adrenals. And then you got this other part of your adrenals that produces like epinephrine and norepinephrine, which are your acute stress response compounds. Like they hit the body immediately. And then the cortex, the cortisol, is like your slow stress response. We'll unpack that in a second. Sheila is sharing, because of childhood trauma, I always feeling fatigued and I've had food intolerances. Yeah, I hear that. It happens. Milk, eggs, beef, wheat, etc. And I'm glad you're hearing this talk, because there's work that can be done to help heal those things. I want to welcome Sihai, who just showed up. Welcome, Sihai. I hope I'm pronouncing your name correctly. If not, let me know, please. So let's say, okay, we got adrenal glands, but they don't function in isolation. They function as part of a system. And this is a picture of a person's, more or less, their brain, right? This is the pituitary gland hanging down in the core of your brain. And chemicals go through the blood to the adrenal glands, and they tell the adrenal glands that say, produce these hormones to help me deal with the chronic stress. And then there's this other pathway that goes through the spinal nerves and the spinal cord that goes to another part of the adrenal gland, says, give me epinephrine, norepinephrine, I need to run away right now. And so that's a short-term stress response from epinephrine, norepinephrine. And then the cortisol is a long-term stress response. And we talked before about mitochondria, and mitochondria respond to cortisol. In the short term, like let's say you have stress over the course of a couple of days, the body actually produces more mitochondria. The mitochondria get more active, they get more potent, they produce more ATP, which is those little energy gas tanks, and they control oxidative stress. They reduce biochemical stress because they're in a hyped up state that says, yeah, we're going for it. You know, this is someone who's like dealing with a short-term trauma, someone who's healthy, but dealing with an emergency. You know, maybe someone who's an athlete who has to run a marathon, or someone who goes on a rigorous hike for a few days. This is short-term. Now, over time, with chronic stress, the mitochondria actually gets sick, and it starts to produce sick mitochondria that can't produce as much ATP, which is cellular energy, and it produces more reactive oxygen or stress or biochemical stress chemicals. And that's from chronic stress, that the mitochondria gets sick. And there's all kinds of research out there from some of the best researchers at Rockefeller and Harvard and all that, looking at how chronic stress and the mitochondria and the adrenals and the immune system and toxicity detectors are all working together. And what it looks like is that mitochondria are like a master controller that takes the overall state of biochemical, sociological, personal stress and sort of modulates the response. And in some cases, what happens, it shuts down the cellular function so a person doesn't hurt themselves. But that can show up in the short term as fatigue and weakness. So let's keep going. So who's in charge of the adrenal glands? We talked about this before. It's a circadian rhythm. Your whole body is controlled, or is meant to be controlled, by a clock. It's in your brain. Your eyeballs receive sunlight, and it goes back your optic nerve, and right underneath your optic nerve, there's a little organ that senses bright light, and it tells your body daytime. Let's start producing certain chemicals and reduce other chemicals. And then it tells your body nighttime. And that's a healthy circadian rhythm. And that's the thing that gets all mixed up when people travel across time zones, when people work late night shifts, when people go out and party till 4 o'clock in the morning, 3 days in a row, when people can't sleep just from having insomnia, and you're sitting up at night reading, you know, people looking at computer screens until midnight or 2 o'clock in the morning. These are all things that mess up that body clock and can cause over time all sorts of problems with regulation of the adrenal glands and other biological processes that are really important. And so this is the adrenal cycle, right? Here's the normal time, 6 a.m., 9 a.m., 12 p.m., up to 6 a.m. again, right? And your adrenal glands are what wake you up in the morning. They get you out of bed. You have a normal cycle that goes boom, first thing in the morning, you get a spike of cortisol that says, I'm up, let's go. And then over the day, that gradually comes down. And then at night, it lets you go to sleep. And that's healthy. And we're going to see about what happens when it's not healthy. Because when it's not healthy, it messes up your sleep cycle. It messes up all sorts of biological factors. And yes, it causes fatigue. So let's start unpacking that. So this is like a contour of cortisol, right? And this little green line in the middle, that's sort of like average. And this is someone who's under chronic stress. And you'll see that instead of this boom and then going down, well, they got a similar contour overall, but their numbers are higher. See how this little spike in the first thing in the morning is higher than the green line? They're still higher than the green line, higher than the line. This person has chronically elevated cortisol. That's like early HPA axis dysfunction, where there's an imbalance in what's going on, where the adrenals are being overcharged. There's too much cortisol, and that can show up as being jittery, being anxious, a little bit of immune suppression, difficulty getting to sleep, difficulty calming down, tight muscles, variety of other things. And then this person has a drop in cortisol. You see in the morning, they're kind of high, but then around noon, they're down under the line. And here they're kind of still under the line. This is someone who like wakes up with a start in the morning, they're going, but like they eat lunch and then boom, they're just crashing and they're pumping the caffeine and energy drinks in the afternoon, or they're taking a nap or whatever it is, because their cortisol is dropping. And that is fatigue. It's adrenal fatigue. Well, I'm not going to call it adrenal fatigue. It's fatigue from low cortisol. And then another thing that he wants to call adrenal exhaustion, I don't like that word. I'm crossing it out. Let's call it hypocortisolemia. That's a mouthful, but it means hypo, low cortisol, right? You see how those bumps, that morning cortisol is lower, lower, low, and then low and low. And this person is just wiped out and fatigued all the time. And this tends to happen after, years of chronic stress, chronic too much stress. This one is like, this is like early stress, could be happening over months or a couple of years. This is later over time where things get out of whack and things start getting low in the afternoon. And then this is like everything is low and the person's just wiped out. And this could be like chronic fatigue syndrome. But again, we don't want to call it adrenal exhaustion because it's not the adrenal glands. And I'll tell you why. It's the overall system. So these are just 3 different kinds of contours. There's a lot of different ways that this little map of adrenal secretion can get out of whack and cause havoc in a person's life, cause a lot of fatigue. So this is getting back to, I think it was Letizia's question, because she was asking about thyroid. And I just want to share a little bit about how high cortisol reduces thyroid function, and it actually reduces the TSH. And this is the weird thing. And a lot of docs aren't paying attention to this, unfortunately, because they just want to want to treat with the TSH. But what's going on here? This is that pituitary gland in the brain, right? The pituitary gland secretes this thing that stimulates the thyroid stimulating hormone. It tells the thyroid to produce more thyroid hormone. Thyroid hormone goes to every cell in your body, and it is kind of like the set point of the cell. And it's meant to stay kind of constant. It fluctuates a little bit, but unlike cortisol, where it's up and then down, thyroid tends to be kind of steady, and it's sort of like your overall metabolism. When someone's got low thyroid function, they're going to be tired all the time. Their voice might get deeper. They might lose their hair. Their skin might get dry. They might just feel crummy. Their mood might be unstable. Their cholesterol can go all up. All that stuff can happen from low thyroid. They might start to speak really slowly too. Cortisol is involved in that because you see, for thyroid hormone to work, you got 2 kinds. You got T4, which comes mainly what comes out of your thyroid. It has to get converted to something called T3. And T3 is what's active in your tissue. If you got plenty of T4 but no T3, your tissue still doesn't have enough thyroid, and you're tired and your metabolism is down because T3 is what matters. Well, too much cortisol blocks the conversion of T4 to T3. So when a person's got too much cortisol going around, they can have a low T3. And normally, if the T3 goes down, what happens is the pituitary gland senses that and says, hey, we need more thyroid. And it sends more TSH out. And it goes to the adrenal gland and it pumps, it goes to the thyroid gland and pumps up the T4 so that you have more T4 and more T3. And so what would happen in that case is a person would go to the doctor and they'd have a high TSH. The doctor would say, oh, you're hypothyroid. Let's give your thyroid some help. But with high cortisol, it blocks that release of TSH. So that person can have low thyroid, a normal TSH, or an only mildly elevated TSH. And the doctor says, oh, you're fine. Don't worry. Your thyroid's okay. Go home. You know, they measure the TSH and the T4, but they're not looking at the T3. They're not looking at the overall system. And that person just gets blamed and shamed. Oh, come on, get over it. Here's an antidepressant. Your thyroid's fine. What are you worried about? And meanwhile, that person's hypothyroid because of their high cortisol and their chronic stress response. Spooky, right? I didn't know about this stuff. I trained at Harvard Medical School. I never learned any of this stuff. But this is what the current research is showing us. International Journal of Molecular Science, 2021. Okay, so the adrenals are out of whack and I feel fatigued. Is it adrenal fatigue? People use that term all the time. It was very popular for the last 40 or 50 years. I hate that term. I don't think anyone should use it. I think it's really misleading, right? This is part of why, right? Somebody did some research. Adrenal fatigue does not exist. I don't really agree that this research does what it says it did. All it means is that they didn't find any research papers that demonstrated adrenal fatigue. But the point is that most endocrinologists really believe adrenal fatigue is a bunch of nonsense. They don't necessarily study the recent research showing a lot of the things that I'm sharing. And so you go to an endocrinologist or even a primary care doctor and you say, I think I have adrenal fatigue. I was reading about it, and they laugh you out of the office. Or maybe they kind of like listen to you a little bit. I spelled adrenal wrong here. Oops, sorry about that. In any event, they don't take it seriously. And there's a reason why they don't take it seriously, which I think has less to do with this research than just the mechanism, because it's not really about the adrenal only. It's the whole regulation system, like I was talking about. There's a feedback loop, right? Like I said, here's your brain, your hypothalamus. It talks to your pituitary, and your pituitary says, release cortisol. That's at the adrenals. And then there's feedback from the cortisol of your adrenals going to your pituitary and your hypothalamus. So there's a whole regulation system there. The brain commands the adrenal gland. The adrenal gland speaks to the body, and the body reports back to the brain and says, hey, we got enough cortisol. Let's turn off these signals that are increasing the cortisol. And that way it maintains a balance, right? And then, you know, the adrenals do all these things that I showed you before, helping the body be in balance. The problem is that this communication loop gets sick over time. And so the whole system gets dysregulated. And so it's not just that the adrenals are sick and they can't produce cortisol. The adrenals are tired. The adrenals are exhausted. The adrenals are weak. No, typically that can happen. There are diseases where the adrenals are shot. And there's a test that they do where they give you a shot of this stuff called ACTH, which is the chemical that stimulates the adrenals. Most people who are exhausted with adrenal dysregulation, you give them enough ACTH and their adrenals produce cortisol. But the problem is that the whole loop of feedback is bent out of shape. It's kind of like the way the TSH gets out of whack in the previous diagram. The TSH is saying very clear, thanks. In my case, T3 doesn't necessarily go where it's supposed to, right? Because the immune system attacks it. And cortisol levels seem okay according to my doctor. Okay, could be. And if your doctor really measured your 24-hour cortisol profile, that's great. A lot of times what doctors do will measure the morning cortisol in the blood. I'll talk more about measuring cortisol in a second. So what I also want to say is that probably there's a lot I don't know for sure. My understanding is that the immune system doesn't attack the T3. But what happens is because of immune alert and inflammation and low-grade inflammation, it reduces the conversion of T4 to T3. And instead of creating T3, it creates a reverse T3, which is a non-functional type kind of T3. Again, it's a protective response, because if you're chronically ill, you need to rest, not go run around outside. And that's part of the way the body adapts, is by going into this hibernation mode and reduces the thyroid function because of chronic inflammation. So it's not necessarily that the immune system is attacking the T3, but typically that the inflammation is reducing the conversion of T4 to T3. Okay, so let's talk about PTSD for a second, and let's talk about depression and the whole adrenal feedback issue, right? We just talked about this whole thing where it's about the feedback. This is someone who's normal, right? Where look at these feedback dotted lines, right? They're kind of medium-sized dotted lines. The body produces cortisol in the adrenals. Some goes to the pituitary, some goes to the hypothalamus and says, hey guys, we got enough cortisol, slow down. So that's great. And that's health, it's balance. What they found in many people who have major depression, really serious depression, is that there's less feedback. The feedback is turned down. What they find in PTSD is the feedback is turned up. So there's a change in the way the hypothalamus and the pituitary are reading the cortisol signals of the body. And that's part of what messes up the symptoms and creates either hyperarousal or depression and exhaustion and emotional distress. And it has to do with the regulation at the level of the hypothalamus and the pituitary in the brain. So it's not a problem of fatigue of the adrenals. It's an issue of feedback and regulation of the whole HPA axis. So what do we call it, right? These are some of the words that modern scientists are wanting to call it. The people are actually up on the current research as opposed to the ones who are looking at 20-year-old research. And the term I like in general is HPA axis dysfunction. But for some people, it's hypercortisol. For some people, it's hypocortisol. Some people say maladaptive stress or stress response dysfunction. They're all reasonable things because it's talking about a complex system that's out of balance. And so how does it get dysfunctional? This is like a normal stress cycle, right? We're meant to have stress and relaxation. Stress isn't bad. You know, the whole idea is here's our stress level over time. And we have stress, and then we relax, stress, and things overall stay balanced. This is a healthy stress response. It's a normal cycle where things are in balance. And then there's chronic stress where things are out of balance, where for a lot of different reasons, there's an overload of stress and the relaxation response isn't strong enough. And again, everything in that 4-part thing that we looked at before, we'll see it again. You know, we talked about danger sensing, we talked about circadian clock, blood sugar, inflammation, all these different things that are conspiring to affect the stress response. And those are all part of this, right? If that builds and builds and builds, then that starts to develop disease states. And, you know, let's talk about the triggering stress event. This isn't always what happens, but this happens a lot. And basically, we talked about the whole genetics, early life trauma, mental emotional stress, HPA axis thing, right? And a person can be in a state of hyperfunction, hypercortisol. That's that early curve where the numbers are high, right? And I actually have a guy who came to me not long ago like this because he lived a really stressed out life. He worked internationally, was traveling all the time, like building hospitals in all these different countries, traveling for 10 days, living out of a hotel, working 14 hours a day. And underneath that, he was a really anxious guy. He was eating a crummy fast food, comfort food diet. He's, you know, got some emotional stuff to work on, I think, living a very stressed out life. He developed celiac disease in his 20s. That's where a person's sensitive to, someone so sensitive to gluten that it creates inflammation in the gut, breaks down the gut lining. He stopped eating gluten, but what we know is that when the gut lining gets sick, if you don't do things to heal it, it doesn't heal. So you still can have kind of a dysbiosis, leaky gut thing, driving systemic inflammation, overall stress response, not sleeping so well, all these vicious cycles working together. And then trigger event. For him, the trigger event was he got corona. He got corona, and that was a boom in stress and inflammation and exhaustion. And wham, he's got post-corona. And he came to me with 6 months of just exhaustion, can't function, pain all over his body, brain fog. And I see situations like this so often in people who have fibromyalgia, people who have PTSD and are kind of functioning for a while, but then like something happens. It could be a minor car accident. It could be an illness. It could be a hospitalization. It could be a horrible, stressful life event, losing a loved one. It's a triggering event that creates a hyper functioning thing, and then they crash. And it's almost like the whole thing tips over, overloads the adrenals, regulation in the mitochondria, and they're crashing. Mitochondria dysfunction. And that's what's going on. And then there's that exhaustion, widespread pain, brain fog, I can't think straight, brain inflammation. This is just like a way to think about two kinds of like too much stress and what happens to people, right? This might be unnecessary here, but like here's normal. We sort of talked about this already. Someone like, here's stress level, they have stress and then they recover and they're okay, stress and recover. And they might have a bunch of stresses, but they recover each time. And then here's someone who like has a really intense stressor and there's no recovery, it just keeps going. They're in a war for 3 years. I saw someone like this who was doing like, you know, an NGO service overseas and found herself in a war zone for 2.5 years. And it just completely wiped her out. And when she came back, she was sick. And it can happen like that over time, or a person can have stress, but they never really calm down from it. And so their stress level stays high, because it's boom, 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 boom. And then a person can have a hypoactive response, like we talked about, from that HPA axis getting downregulated. So we're back to the way doctors think. Disorders of HPA axis dysfunction or function. And these are diseases that modern medicine recognizes as are being associated with alterations in HPA axis function. And so, you know, diabetes, post-traumatic stress disorder, chronic stress, adrenal dysfunction, Cushing's syndrome, fibromyalgia, drug withdrawal, a lot of different diseases that are chronic dysfunction, the HPA axis dysfunction, but they're diseases and they're not causes. They're effects, they're not causes. And when we have chronic adrenal dysfunction, it can be much more than just the disease state. It's like I was talking about before, frequently they treat the disease, but then a person's still feeling like fatigued or depressed or indigestion or lightheaded or dizzy when they get up, or insomnia, craving food, headaches. These are all symptoms that people who have imbalanced adrenals often have. And these are symptoms that don't get taken seriously. And this gets back to that initial picture, the doctor saying, hey, all your tests are normal. And again, it can include, I forget who said it, right? A normal cortisol. You can have a normal blood cortisol level done in the morning, and it could be okay. Part of the issue is like this, okay? And this is the thing that I didn't know about until a few years ago, which is that the normal cortisol they check is sometimes it's not even a free cortisol. It's the cortisol that's bound to certain proteins in the blood. And you can have a high or normal level of cortisol in the blood or a low level of cortisol in the blood, depending on how much it's bound to those proteins, which are affected by so many different things. And when we do saliva testing, it actually looks at the free cortisol. So that's why I don't always trust the morning blood cortisol level. So in any event, all your blood tests are normal. I think you're fine. And meanwhile, the person is saying, my gosh, I feel horrible. I got all these symptoms. Oh yeah, there it is, right? No energy, headaches, couldn't lose any weight. You guys might be tired. Ramila is asking, I've heard of people getting over their, or seen people getting over their peanut, tree nut, sesame allergies, adults or children. It's been adults. I'm not a pediatrician, so I'm not so much involved in pediatric stuff. Sheila's saying good information. Thanks. It's a ton of information, right? This is supposed to be like a 45-minute webinar with Q&A. I don't know how to not do this yet. I'm still learning, so please forgive me. I got a bunch more slides. If you can't stay, I understand. There'll be a replay. I'm going to keep going because that's what I'm here for. So bear with me. Share your questions. See how he's not tired, enjoying it. Great. All right. I hope I don't get tired. Let's see how it goes. I'll do my best. Yeah, so this is something I hear so often, and there's actually research to show this, especially in rheumatology, where the time between symptoms and diagnosis is frequently half a year, multiple years. You know, the person showed first stage is I'm fine. Sorry, this is time, and this is what the person's saying. I'm fine. And then at a certain point, I don't feel so good, but they go to their family doctor, they have normal labs, and they say, don't worry, you're fine. Meanwhile, I'm getting worse. They go to the doctor, maybe they see a specialist. Oh, you have a couple of abnormal labs. You have an elevated ANA, or you have a slightly elevated CRP, those are inflammatory markers, or you've got this or that test, which is like your liver enzyme is a little elevated, but don't worry about it. You're going to be okay. Let's check you out again in 6 months. Meanwhile, the person's just not feeling well. And they send them home and say, come back in 6 months. And they're feeling worse. And they got more normal labs. And then the doctor says, I'm sorry to say, you've got this disease. And they get a diagnosis. And this could be 6 months. This could be 6 years. Because there's a continuum here of I'm fine and everything's okay. I'm completely in balance. Most of us aren't like that in 2022, unless we're like 7 or 14. And then there's like, I got normal labs, but I don't feel so good. Something's up. I don't know what it is. And nobody does. And then they might have some more normal labs, but like, it's not so bad. And the doctor's not taking it seriously because I'm not sick. Because doctors are trained to think about sick. And the doctor's not a bad person for responding this way. This is the way we get trained. The person doesn't look sick and they don't have a disease that I can diagnose. So what am I going to give them a bunch of heavy meds to fix it? So that doctor's not thinking about lifestyle. They're not thinking about health. They're thinking about disease. They're thinking, is there a disease I can fix? There's no disease for me to fix. There's nothing for me to do. On the other hand, if the model is health and the model is, there's some imbalance, the health isn't right. What can we do to gently move the health in the right direction? And that's what we're about, functional medicine. Thanks, Louise. Sahai is saying, are you taking new patients? I was Dr. Harani's patients. Yes, I have to say, Dr. Harani is a great doctor, and she's more of an expert in hormones than I am. And I'm also taking new patients, but I'm obliged to tell you, she teaches me stuff about hormones all the time. I'm going to stand up because I'm getting exhausted here. There we go. Thank God I got this standing table. Let's keep moving. There's a lot more to talk about. All right. This is my favorite diagram I've seen in a long time. This is again from Dr. Gia. Oh, we saw this already. I keep talking about this. What makes the brain stressed? Let's unpack this a little bit. We all started talking about it. We already started talking about it. Why does it happen? Why do these 4 things happen? What can we do about it? Right? We got this whole perceived stress and danger thing. We've got circadian disruption, meaning the circadian rhythm is on. We've got glycemic dysregulation, meaning blood sugar control gets out of whack. We've got inflammatory signaling. These are 4 major categories of biological imbalances that we can actually treat with lifestyle, with nutrition, with supplements, with a healing approach to bring the system back towards balance and health. And these are 4 categories that we can work on. Adrenal activation is an issue of safety or danger versus danger. And it's all about perception, whether it's your mental, emotional, spiritual perception, or the level of the organism, immune, cellular, I'm just kind of repeating this in different ways because I really want it to sink in. How do we diagnose adrenal dysfunction? Okay, so this is getting back to, this is the way I like to diagnose adrenal dysfunction from kind of a medical point of view or a functional point of view, which is again, salivary testing, because it looks at free cortisol. And there's definitely a growing body of research from the past 10 years showing that Salivated cortisol is a good measure of free cortisol that's in the blood, and it's really easy to do it. And the problem with blood cortisol is like this. You could be fatigued, you go to the blood lab, and they stick you 4 times by the time they get it because you got diabetes or your blood vessels are small or whatever it is. So they're giving you a stressor. So your system's going whack, 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 producing more cortisol. That can be part of the issue. But this is like you spit in a little cup, you know, and you do it 4 times so we get that contour. Low stress, easy collection. And again, here's that normal contour. And here's how that looks, right? If you go to a functional doc and they check for your 4-point adrenal test, this is what we're looking at. We're looking at that peak in the morning, and the green is the average, and yellow is a little bit above or below, and red is way above or below. And this is normal. We kind of looked at these before. And then you can have an increased one in the normal. And this is like high morning cortisol. This is an early adrenal hyperactivity thing going on. And this is high during the day. And this is I'm wired during the morning. I get up and go. I might not even know it, right? Because yeah, I've got a good morning response. I can do it. I get a lot done. Afternoon, I'm normal. Maybe I'm a little tired in the afternoon. And this is I'm wired all day. And maybe it's hard for me to sleep at night. And I'm just like jittery and I can't sleep and I'm not a happy camper. And this is like, okay, I'm pretty cool most of the day, but at night it goes up. And some people flip over like that. Like this is almost backwards from what it's supposed to be, where it's supposed to be high in the morning, go down at night. And this is like kind of normal during the day. And then at night they go high. And that's the person who's kind of in this situation where like they get a second wind, and in the evening they're wired and they're up and they're working until, you know, when they should be sleeping, what's going on here? Right. When they're at work, they're sleeping. When they're at home, they're working. So they're all out of balance. This is a confusing cartoon. I thought I understood it when I first saw it, but it's a little confusing. The whole point is like tired during the day when you want to be working and you're really sleeping. And then at night, when you want to be sleeping, you're up and you're doing stuff. And then this is just overall low cortisol. This is someone who might have chronic fatigue syndrome. You know, in terms of intensity, there's a difference between chronic fatigue and chronic fatigue syndrome. Chronic fatigue syndrome is a really serious disease where these processes have been going on for years and years, and the person often has various things, whether they're genetic or lifestyle or triggers, that really have knocked their system for a loop to the point where like they really can't function. They really can't get out of bed, can be profoundly disabled. It's really a horrible situation. And so there's chronic fatigue and there's chronic fatigue syndrome. And it's a level of severity and intensity. All right, let's keep moving here. Wow. So why does this happen? We've already talked about a bunch of this. I'm going to move through this a bit because I think we covered a lot of it, but just reemphasizing briefly, it's like the stress response goes on, the emergency vehicles are blocking the roads, all the other traffic backs up. That's in the short term, it's okay. Over time, it's maladaptive because the stress response is doing its thing, so the body can't do its normal functioning. A lot of different things that can be as stressors. Again, this is from a book called Adrenal Fatigue by Dr. Wilson from 40 years ago, and he's the one who coined this term, and he coined adrenal stressors. And I'm just kind of jumping in here and saying, if I had made this slide right, I have a big X out of here, because it's systemic stressors. It's stressors of the whole being, and they affect the HPA axis balance. They affect the regulation of the adrenal system. And these are some of the things that do it. Y'all can read them. And hopefully they won't be affecting you too much. Here's where I should have a nice, relaxing nature picture, don't you think? So we can all kind of relax and go, right? Nature is healing for many people. Does anybody find nature healing? Like if you go out someplace beautiful and calm, whether it's the sea or the mountains or the forest, does it feel good to you? For me, I feel like that's part of connecting to our natural rhythms, that whether you believe in evolution or God or both, We were created or evolved in relationship with life, in relationship with the natural world. And the natural world has a profound degree of potential healing for us. I got a lot to say about that. Okay, let's keep going. These are some of the disease conditions that actually arise out of stress, HPA axis dysfunction. And these are some of the chronic illnesses that come out of it. And, you know, if you go into PubMed, which is like the list of all the medical research, you just find tons of articles now. You know, 40 years ago, we didn't know all this stuff, but cardiovascular, just, you know, cholesterol, diabetes, obesity, autoimmune disease, chronic pain, fatigue, fibro, neurodegenerative disease, multiple sclerosis, cancer, gastrointestinal diseases, thyroid diseases, like we talked about, hyperactive stress response, dysfunctional HPA axis. All right, what can we do about it? This is what really matters, right? It's good to understand it, but let's talk about what we can do about it. All right. So basically, we want to turn off the imbalances. We want to support the system to heal. Turning off the imbalances meaning, look, I'm seeing stuff that's off and it's wrong and I want to fix it. Supporting the system to heal is part of that. It's connected to that. But there's a healing that is kind of transcends what we do to ourselves. There's a healing that comes when we just move towards the health that's within us. And that's where we're at in our mind. It's what we're at in our eating and our attitude towards life, our relationship with other people. It's like, do we choose to honor and value our life, our individuality? Do we see ourselves as unique, important, valued humans? Because when we do, we tend to do things to take care of ourselves. And when we don't tend to take care of ourselves. So I'm going to unpack and pull this apart a little bit as a way of understanding it, because I think Dr. Guillaumes gives a great framework, right? And the first thing I want to point is we'll look at these 4 quadrants, and then we'll look at this other model that I like to share, which I call, perceived danger, circadian disruption, glycemic dysregulation, inflammatory signaling, and what I like to call the 3 M's. And I kind of came up with this model just to like put it in context, because these are sort of the 3 handles you have on your physiology and your biology in terms of things you can do to help yourself. You got your mind-body relationships. You've got your movement system, your ability to move and exercise and use your physical body, your structure, or your mechanical system. And you've got your metabolism and biology, your diet, supplements, nutrients. And these are 3 interlocking circles because they're so profoundly interconnected. We could talk for an hour about just that. And then at the core, where those 3 are meeting, there's a little light in there, right? Because we don't really understand. We don't understand what's at the core of a human being. Some of us are materialist, concrete people and say, yeah, we're just a physical body. We don't have a soul. There's no divine spirit, right? Some people want to believe that. And if they do, I respect that. But like, that doesn't mean we understand everything. It doesn't mean we can quantify life. We can't quantify all the things that go into healing. So you could be the most concrete person in the world and you could think science has got it figured out, but science doesn't have it figured out. There's a vitality, there's an aliveness, there's a deep intelligence inside the interaction of all the different body systems that modern science has just been started to touch the surface of. And then if you're a believing person of faith, or if you believe in universal consciousness or life or vitality, what you believe is that there is an intelligence that moves through us, that enlivens us, that brings us towards health if we choose to listen to it and follow it. Okay, so first quadrant here, the whole perceived danger thing. These are things you can do: mind, body, movement system, metabolic system. And a lot of these are probably obvious, but the core of mind body is self-regulation. It means bringing on the physiology of calm and quiet. That's the relaxation response. And it's not hoogie-woogie. It is a biological, neurochemical, neurobiological response that's shown to reduce inflammation, create calm, modulate stress hormone production, modulate cortisol levels. And then there's deeper levels of healing from things like mindfulness and CBT, which are training processes and therapeutic processes Dealing with underlying trauma, especially if you've had PTSD or adverse childhood events, or even if you've had the trauma in recent years of being really sick, someone who was hospitalized during the pandemic. Oh my gosh, terrifying, right? Like, what does that do to the system? Trauma is when the throttle gets stuck in the on position and the person's stuck in a stress response. That is a integrated biological, mental, emotional experience. And healing that depends on meeting it to a certain extent. Doesn't mean you have to go back in the time and like blame your mother and father for what happened to you when you were a kid. But it does mean meeting your felt sense in your current life. And there are body-centered psychotherapy approaches, things like, well, I'm not going to go into the particulars, but there are approaches to psychotherapy that aren't just about thought and thinking and talking, yada, yada. It's about meeting your felt experience and bringing your calm, aware, intelligent, adult, caring mind to it, either with the support of a therapist or in your own process. And that's part of what helps heal those traumatic memories. Moving on, fun, joy, laughter, connection with what matters, connection with meaning and purpose, intentionally connecting yourself to positive mind states are a tincture and a treatment for all the negativity and difficulty that's going on in the world. And these things are hugely important if you're dealing with a chronic illness. Getting into the movement system, appropriate exercise, appropriate moving. And I say appropriate because if you've got chronic pain, you may be limited in what you can do. If you get chronic fatigue, you may be limited. You might have a biological threshold. And if you go above it, you get post-exertional malaise or a flare-up of your fibro or your flare-up of your back pain. So you got to find the right thing. I'll talk more about these things. Hopefully I won't overdo it here. Yeah, brain chemistry support. There are things you can use that are botanical, natural products that balance the mind, that balance neurotransmitters. Hands-on treatment is so soothing and relaxing. It stimulates the relaxation response. It's connection with another caring person. It's going into the room and someone else is showing up and saying, hey, I got you. Lie down, relax. Here's some nice music, some nice smells. Hands-on. Wow. We need touch. We all need touch. And it's profoundly healing. And then the metabolic stuff in terms of what are you eating? Are you eating high carb, low protein, low fiber, sugar, stimulants, all sorts of stuff? Or are you eating stuff that actually promotes stable mood, that calms you, and supplements that are calming? The next quadrant, circadian disruption. There's a lot of overlap here, but there's some differences, right? Sleep hygiene is the choice to go to sleep at a normal, healthy time. It's the choice to turn off your devices. If you need to use your computer, you put on a blue screen filter that takes out the blue light because it's been shown to stimulate the stress response. I have a filter that turns on at 9 o'clock. So if I'm on the computer, it's kind of like a brownish orange and it's less stimulating. Think about your schedule, your priorities. Are you working late shift? Maybe you can change that. Waking up in the morning and going out in the bright sunlight. If you don't have bright sunlight, getting a lamp, because there are special lamps to give full spectrum light that stimulate that gland that says daytime, daytime, and it helps stimulate that circadian rhythm of cortisol. Melatonin is a opposer of cortisol in a certain way. It's your brain's mechanism that says it's dark. Let's start shutting down, guys. Time to turn it off. That's why melatonin can be so helpful to fall asleep, but not stay asleep, but it can help you fall asleep. At higher doses, it's actually calms neuroinflammation. We're just starting to scratch the surface of melatonin, but that's one of the sleep support things. There's a number of other different things that are more appropriate for trying to help you stay asleep. Some people who have adrenal dysregulation, they get hangry, right? Like their blood sugar fluctuates because the adrenal thing. And like if they don't eat for 3 or 4 hours, their blood sugar goes down. What happens if your blood sugar goes down at 2 o'clock in the morning? It's an alarm reaction. Your body wakes up, it creates a stress response. That's like that instability of dysfunctional adrenals and glycemic control. And so for some people, eating a little protein in the evening, which is kind of a slower burn, might last you to the morning and get you so you can sleep longer hours at night. So try eating half an egg or depending on what you can tolerate. And then movement, exercise, potentially helping with pain, helping with exercise and insomnia, really important connection there. The biochemistry of vigorous physical exercise promotes sleep, promotes calm, promotes well-being, promotes circadian health. And that doesn't mean like working out intensely at 10 o'clock at night. You know, getting back to the whole thing with the contours of adrenal dysfunction, like if your adrenals pumping in the morning, they're working, but in the afternoons you're dropping out, the morning is the time when you might want to exercise, because it could be that by the afternoon, you're just too wiped. All you can do is get through the day and get home, right? But so then you work out in the morning when you have some cortisol, and you get the benefit, all the biochemical benefits of doing some vigorous exercise in terms of stress hormones, in terms of endorphins, and the biochemistry of producing positive neurotransmitters that come from vigorous exercise. And then glycemic dysregulation. You know, we talked about some of this, but getting back to the mindfulness thing, the self-awareness, the relationship with self. Am I eating in a way that's healthy for me? And I teach mindfulness meditation, among other things, movement arts and all kinds of different meditation things. And I can remember a client, one of my patients who took the course, was dealing with chronic pain, fibromyalgia, obesity. And we did an exercise of a mindful eating. And she usually had this really intense face. And we did a simple exercise about eating like a little raisin piece of fruit. And she was just like grinning and giggling, because it's like you slow down, you smell it, you taste it, you chew it, you really take your time eating something delicious. And she's like, I never know my food could taste this good. I've just been shoveling it in my mouth because I was so anxious and feeling sad inside and eating to stuff my emotions. And she started eating mindfully because it felt good. Like she went into mealtime, if she was dealing with anxiety or distress, she did a little meditation. She hung out with her anxiety and distress. She brought some calm to herself and ate mindfully. She stopped stuffing herself. She lost 30 kilograms. That's like 65 and 66 pounds. They say 30. She lost a lot of weight. Her pain got better. Her blood sugar got better. Her autoimmune disease got better because she changed her eating, because she changed her relationship with herself. Amazing, right? Vagal tone, to reduce stress, helps glycemic regulation. It reduces inflammation, which is part of type 2 diabetes. Exercise has a known effect on blood sugar. When you get regular exercise, it will control your blood sugar. It will help your body utilize blood sugar, utilize oxygen. If you get regular exercise, not only will it help glycemic control, it balances your adrenal function, your stress hormone function. It brings your body back towards health. So getting exercise is so incredibly important. The key question is how to do it in a way that works for you. And if you can do rigorous exercise, then you do it. If you can't do moderate or rigorous exercise, you might need to do something more mindful, like yoga or Tai Chi or Pilates or Feldenkrais, something where you're learning how to move in concert and harmony with your body, where you're not, beating the machine, because maybe your machine can't take that right now. But you start where you are, with harmony and with compassion on your body. And you build from there gradually. You learn to do pacing. It's a whole art and science. Some physical therapists are really great at teaching people pacing, at teaching them mindful exercise, so they gradually can build their exercise tolerance. All right, metabolic, again, diet, very important here. Low glycemic index, healthy proteins, high fiber, healthy fats, glycemic support supplements, medications where necessary. That's like, and then get into the last piece, which is inflammatory signaling. Big thing, right? I was talking already about vagal tone, self-regulation, relaxation response. When you stimulate your vagus nerve through relaxation, it stimulates a pathway in your gut that is anti-inflammatory. It's been proven to reduce inflammatory chemicals that drive chronic illness and autoimmune disease. There are big companies that are investing millions of dollars in invasive vagal stimulation devices where they put an electrode in your neck and electrically stimulate your vagus. and having it do things like reverse arthritis in certain people. But you can stimulate your vagus by breathing, through attention, through mindfulness, through love, through connection, through intentionally cultivating joy, positivity, gratitude, and all sorts of other positive mind states. Again, appropriate exercise is anti-inflammatory. You want the right amount, not too little, not too much, in your threshold. Grounding, that's kind of a weird one, but it looks like the Earth's electromagnetic field seems to affect inflammation. There's research showing that. So people do things like lie in the grass, forest bathing, getting in a bathtub if your building has metal pipes, not lead pipes, but ferrous pipes that conduct electricity, that are connected to the ground. There are grounding mats that you can buy that connect you to the ground. They reduce oxidative stress. Sheila's wondering, can we get the recording? Yes, you can. Can you get the slides? That's a good question. I don't know. I'm going to figure that out. But yeah, if you contact the practice, Rose Wellness, where I think you signed up, then they can get you the recording. And if you're watching this on Facebook, just make a noise in the group there where it's being posted, and I'll figure out how to post the recording. Well, I guess the recording will be there. And I'll see about the slides. I'm not sure about the slides yet, Sheila, but I don't see why not. Yeah, metabolic, nutrition, inflammation, a gut healing diet, getting back to the question of, can you heal the gut? Yes, you can. Low antigen, dealing with food sensitivities, getting the biome healthy, healing the gut lining. And then, the whole gut system, your liver, your pancreas, your stomach, your intestine, your biome, it's one system. All right. And this is just unpacking some of the things, like taking them out of the context of these 4 quadrants. But there's a few things that I might not have mentioned before. LDN is low dose naltrexone. You're welcome, Sheila. Rose Wellness will be sending out the recording. Thank you, whoever that is. That's probably Donya or maybe Sanjay. Thank you. LDN is something called low dose naltrexone. It's an off-label medication that's used at a very low dose that stimulates your body to actually produce more endorphins, which is anti-inflammatory, anti-pain, tends to quiet down, irritable bowel, and frequently is energizing. So a lot of people with fatigue use LDN, and it's incredibly potent and powerful for certain people. It seems to be very safe. I think I spoke about a bunch of this stuff. Yeah, healing the gut and really clarifying sources of chronic inflammation. This is hard to do on your own, right? The simple gut thing of doing an elimination diet, thinking about food sensitivities, you can kind of figure that out. Ramila is asking a great question. Can someone from Rose Wellness discuss food allergies in children and teens with you? That is a great question. I think probably, the practice, I think, has at least one family practitioner who's taking new patients who is much more familiar with working with children and teens than I am. So I would recommend reaching out to the practice if you can, Ramila. If you're not sure how to do that, send me a message or put a message in the chat. And I think probably Sanjay or Danya will respond to that or give you some information. Technical support help. Sources of chronic inflammation, gut infections, sensitivities, toxic exposures. It's complex. Sometimes you need someone to help with that, right? There are stealth infections. There are all sorts of things. Yeah, I get it, Ramila. You need to get at your children's health. I applaud that. And I appreciate you as a mom doing that. So may you be guided. May you find the right path. And then, okay, direct treatment of the HPA axis. And this, again, is something that's very personalized. And I don't recommend people just going out and taking most of these things on their own. I mean, phosphatidylserine, L-theanine, and ashwagandha are pretty safe. Licorice, you can get in trouble with some of these things if you take too much, if you don't know what you're doing in the wrong conditions. But these are things that affect, not just affecting the adrenals, but they affect the overall regulation of the system. They affect the way the brain and the body process glucocorticoid and cortisol signaling. So These are things that, depending on the contour, depending on the way that 24, and depending on the clinical picture and depending on the contour of that 24-hour cortisol panel, these are things that I sometimes recommend to balance, boost, kind of. And again, this is not fixing the problem. This is kind of helping the downstream problem, which is the dysregulation of the HPA axis. And then we got to go upstream to cause. And that's that 4-quadrant thing that we've been talking about. So again, it's like, these aren't medications. These are a bit more subtle than medications because they're really helping the body balance itself. In Eastern medicine, these are used together in various combinations to really balance the adrenals and overall health, and really powerful stuff. But it's also important to go upstream and really get at root causes. And dietary stuff, we talked about some of this, but this is just very good general advice. Eat breakfast, less simple carbohydrates, complex carbs, more fiber, healthy proteins. I try to eat organic food whenever I can, because you know what? Our food supply is more and more toxic. There's more and more stuff. Lots of fruit and vegetables. You know, polyphenols are the colored stuff. I have a sheet called polyphenols, and it's all these colored fruits and vegetables, anything with color. It mops up free radicals. Those are your body's, the world's natural antioxidants that were created by, like, the God evolution dance, right? And we came into existence in relationship with those things. They're there for us. They're there synergistic with us, part of health and well-being. Like, you know, I went on this journey 20 years ago of meditation and spiritual practice. And for me personally, what I came to was just finding the inner voice. And so it becomes less about, oh yeah, I was told I need to eat this and not eat that. And more like, oh my gosh, this is alive. I want to eat this. And that is dead. I don't want to eat that. I want life. So that's a personal thing. Not everybody gets there, but it's potential for everybody. Plenty of water, smaller, more frequent meals. Yeah, I just wanted to say a bit more about movement, mechanical stuff. I think I talked about this a little bit, but there's a variety of ways to move, and they're all really important. There's aerobic training, there's strength training. If your body can tolerate it, do it. There are benefits of aerobic and strength training that you can't get anyplace else. And then there's mindful movement, which is meditative movement, whether it's Tai Chi or yoga or Qigong or these other systems that are really about bringing your calm relaxation, meditating in your body, moving from the inside out, that you don't get from doing aerobic and strength training. And they're very complementary, and everyone's got sort of their sweet spot about what they really need. But the invitation is to explore them. If you're dealing with a chronic stress situation, mindful movement is frequently very beneficial because you're bringing relaxation into it. You know, there's a whole thing about the vagus, the relaxation response nerve, and polyvagal theory. And polyvagal theory posits that there's different layers of the vagus. There's the polyvagal part that has to do with our thoughts and emotions and the face we put onto the world. There's the vagal function that has to do with emotional and biological regulation and bodily regulation. And when you're just kind of cranking your body up to do aerobic exercise, you definitely get this counter-regulatory relaxation that happens afterwards. And that's that runner's high, or that good feeling people get after they work out. But if you bring your consciousness into your body through one of these mindful disciplines, you're stimulating that embodied vagus nerve while you're moving. And it seems to me like there's an extra benefit from that. And then we talked about hands-on stuff. Again, just that working on the body from somebody, which is calming, which is connective, which releases important chemistry and hormones, which can shift energetics, shift pain, shift structure in so many valuable ways. Yeah. And then there's the life, the work of life, of coming into relationship with the life and choosing to be alive and connect to beauty and love, choosing balance. And these are all really important things. So what I'm going to do right now is figure out how to stop streaming because none of you signed up to be on my Facebook page. So I'm going to stop the live stream. If you're there on Facebook, thanks for joining us. When you see this recording, if you have questions or comments, put them in the chat. I'll see them later and try to respond to them. So check those out and let me know how I can help you with this stuff. I'm going to stop the live stream now. Thank you for watching. And for those of you who are here, let's figure out how to be in touch. I'm going to open up to comments and questions. People are saying thank you and excellent. But if anyone has a question, let's check into that. Does anybody feel like sharing anything or asking anything out loud? You could raise your hand and I'll unmute you or ask you to unmute. And let's try that. If anybody wants to speak to something in particular, I can stay for about another 5 or 10 minutes. No obligations. All right, looks like no one's jumping out to do that. I want to thank you all for being here. And I'm not going to read this slide. You know, yes, you can go over the presentation again. It will be shared with you. I'm glad you liked it. And Jose, you could look me up. I mean, my stuff is out there. My name is out there. And you've got my name, Andrew David Shiller, somewhere here, I'm sure. So yeah, you can track me down online. I have, I produce content through Rose Wellness, and I also produce a lot of free content that's out there on YouTube and Facebook, and you're welcome to check that out, and hopefully it's of service to you. And I really appreciate you all being here. Letiza, no questions, just thank you. Interesting, well explained, great. Glad you liked it. All right, it's a pleasure to meet you all. I hope it's good for you. And I hope that wherever you are in the world, you find your path, and you find that path and realize that it's not just about someone fixing you and healing you, but it's about the healing journey inside your own self, and about the things that you can do to help yourself, the self-reflection you can do to find that integration within your own being, which is where real self-healing springs from, that there's a deep intelligence inside of you. And it's in your habits and your behaviors, but it's also in your inner relationship. So I want to give you all a big positive wish and blessing that you find that, and it's good for you. So thanks for watching. Thanks for being here. Yeah. Okay, I'm going to end. Take care. Thank you, everybody.